Welcome to the 5 on 5. We are pleased to be joined today by Jackson Care Connect Medical Director, Dr. Matt Hough. Dr. Hough, thanks so much for being here today.
Thank you, Kristen, for having me on the show.
It's a pleasure. Now, we've been running several promos this month talking about Go Red Month, the American Heart Association's Go Red Month. Can you tell us what Jackson Care Connect is doing to help improve heart health in Jackson County?
Yeah, so Jackson Care Connect is partnering both with providers and members. We're providing patient education. We're encouraging our members to make an appointment with their doctor, and we are also investing in exercise programs that promote heart health.
All right, talking about that right away, exercise. What are some things that people can do to improve their heart health?
Well, so for one thing, exercise, probably everyone knows this, is probably the easiest and most important way to improve your heart health. We recommend that you get at least 30 minutes of exercise 5 days a week. Make it simple. You don't have to climb a mountain. You can do a brisk walk. If 30 minutes seems like it's too much, you can break it up. So you could do 10 minutes 3 times a day, after breakfast, after lunch, after dinner. Another thing, you can join a health club. So Jackson Care Connect, for example, is partnering with the YMCA. We have scholarship programs to their health. It's a 12 weeks to a Healthier New You program. We've had 1,700 members participate up to this month. It's a program that is geared towards weight loss as a mechanism for improving heart health.
Okay. Maybe talk a little bit about the impacts of heart disease for women.
Yeah, so it's a big problem. Heart disease is the #1 killer for women in America. In fact, it's the #1 killer overall for all Americans. For women ages 40 to 60, so in that age group, 4 out of 5 will have at least one risk factor associated with heart disease.
Wow, that's pretty amazing.
Yeah, it is pretty amazing. So those risk factors tend to be lifestyle related. So the good news about that is we can impact them, and they include things like smoking, lack of exercise, being overweight, high blood pressure, high cholesterol, too much salt in your diet, and they're sometimes associated with other conditions like diabetes. So if, for example, if you take good control of your diabetes, you decrease your risk of heart disease.
Well, we've got much more to talk about, Dr. Hough, but we're going to take a quick break. We'll be right back.
Thank you.
Welcome back. We are pleased to be joined once again with Dr. Matt Hough talking about heart health. We've been talking a little bit about exercise and diet, and when you start factoring all those in, it can kind of seem overwhelming.
Yeah.
What's something simple that someone could do today to start making those positive changes?
Yeah, so small changes can make a big difference, right? So something you could do today, you could start reading labels on your food to know how much salt, how much cholesterol, how much bad fat you're taking in every day. Another example, if you eat fast food and you have it several times a week, reduce it. Fast food is notorious for having high levels of cholesterol, bad fats, and high levels of salt as well.
Okay. Now, long term, what are some things people can put on the calendar or put in place that they need to be thinking about? Yeah,
so first and most importantly, make an appointment with your doctor for a wellness exam, right? They can tell you a lot about your heart health, right? They can tell you about your cholesterol, your blood pressure, and your weight. And if any of these are abnormal, ask them what you can do to improve those.
Okay.
So another thing, you can quit smoking. So Jackson Care Connect has tobacco cessation programs. We have 8 of them coming up in the near future. The first 2 are in April, on April 17th and 20th. They are open to the general public and they are free. Another thing you can do is you can reduce your exposure to secondhand smoke. Get a loved one to quit smoking. Eat more fresh fruits and vegetables, less processed foods. And probably just as important, get your family involved. The work you do to improve your heart health may inspire a family member to do the same in kind.
And also that good support system too.
Right.
So talking about diet, exercise, and smoking, heart health, but also just your overall health. These are great things just to keep in mind if you're trying to improve any part of your health.
Yes, absolutely.
Anything that we didn't touch on or anywhere that people can get more information?
At the American Heart Association's website, the Go Red campaign would be a good place. Also with your doctor.
Fabulous. Well, Dr. Hough, thank you so much for spending time with us today.
Thank you very much.
We'll be right back.